Welcome to day 11 of our CPC exam prep series, brought to you by KS Medical Coding Academy. Today, we're beginning the surgery section and focusing on one of the most commonly tested areas, the integumentary system. The surgery section in the Captain Manual spans from code 10021 through 69990. It's organized by anatomical body systems, starting with the integumentary and ending with the nervous system. Each subsection has specific coding guidelines, and the section overall includes a wide variety of procedures, both major and minor. Understanding how to navigate this section is crucial for CPC exam success. Before diving into specific codes, let's review the concept of the global surgical package. This includes all the services provided before, during, and after a surgery that are considered part of the procedure. This typically includes the preoperative visit, the procedure itself, and follow-up care within 0, 10, or 90 days. This bundled approach applies to many procedures in the surgery section, including integumentary, musculoskeletal, and cardiovascular codes. The integumentary system codes range from 10,021 to 11,983. This area includes procedures on the skin, subcutaneous tissues, nails, and breasts. These are often high-yield questions on the CPC exam because they're frequent and involve nuanced details like size, location, and technique. Some of the most common codes in this section include 10,021 for fine needle aspiration, 10,120 for foreign body removal, 11,000 through 11,046 for debridement procedures, 11,100 to 11,102 for skin biopsies, 11,400 to 11,646 for excision of benign or malignant lesions, 12,001 to 13,160 for wound repair procedures, including simple, intermediate, and complex closures. Memorizing key code families and their ranges will help you locate them faster during the exam. Let's break down some critical tips for coding lesions and wound repairs. First, size matters. You must report the largest diameter of the lesion plus margins when selecting a code. Second, location matters. Lesions on the trunk are coded differently from those on the face or scalp. Finally, understand the type of repair. Simple repairs involve a single layer closure. Intermediate repairs include layered closure. Complex repairs involve scar revision or tissue rearrangement. Always read the full code description for these details. To improve your speed during the exam, tab the integumentary section, 10,021 to 11,983. Highlight important codes such as 11,400 for benign lesion removal and 12,001 for simple wound repairs. Also, mark the start of the surgery section and the global surgical package guidelines for quick review. Let's practice a real-world exam scenario. A patient has a 1.5 cm benign lesion removed from the neck. Since the neck is part of the head and face region, and the lesion is 1.5 cm, we look under excision of benign lesions of the head, face. The correct code is 11,422. This type of question often appears on the exam, so practice recognizing the key elements, size, type, and location. Now, let's take a short quiz to reinforce what we've learned. Pause after each question and try to answer it on your own before checking the answer. Question 1. A 2.0 cm benign lesion is excised from the right forearm. What is the correct Captain code? Answer: 11,404 excision of benign lesion on arm, leg, 2.1 to 3.0 cm. Question 2. A single layer repair of a 3.5 cm laceration on the face is performed. Answer: 12,051 simple repair, face, 2.6 to 5.0 cm. Question 3. Which service is included in the global surgical package? Answer: routine postoperative care. Question 4. A punch biopsy is performed on a lesion on the back. Answer: 11,102 punch or tangential biopsy. Question 5. A 1.8 cm malignant lesion is removed from the scalp. Answer: 11,622 malignant lesion, scalp, 1.1 to 2.0 centimeters. To recap, the surgery section is a major focus area for the CPC exam. Integumentary coding alone can account for 5 to 8 questions. Always pay close attention to lesion size, type, and location, as well as the type of wound repair.